Thank you. Good morning, everyone. Welcome to County Executive Stuart Pittman's weekly press conference. We are also live streaming on Facebook and recording. I'm Roz Hamlet. I'm the County Executive's PIO. I'll be moderating the media questions. We've got lots of information today, so we're going to get started with the County Executive, and he'll be followed with an update from Dr. Nilesh Kalyanaraman. Mr. County Executive.
Thank you, Roz. Welcome, everybody. The good news is new cases reported as of 10 o'clock this morning from yesterday was only 69. And our case rate is down to 21.4. Not as good news is that we're still losing our neighbors to this virus, 21 in the last 7 days. And if we continue at this rate, we will have reached 500 deaths in Anne Arundel County this week, and including the 14 who were not tested, but who doctors believe died from the virus. And when that happens, I believe it is important that we recognize the loss. I will be at the health department with the same bell that we used when we hit 300 when we were lighting the Glen Burnie tree, and recognizing that loss of life. We'll let you know about that when that time comes. So I do want people to remember that the work that we're doing is about saving lives. It's also about jobs and income and mental health and education, and the fact that we're lifting some restrictions, I think, is the right thing to do given what our case rates are doing. But that does not mean that this thing is over and that we have to behave any differently. In fact, I guess I should, in the interest of transparency, tell you that I am at home on quarantine, having been exposed last week at a site visit, and my quarantine will be lifted, assuming that I feel well. End of the day tomorrow, Thursday morning, and I'll be back out of this room, and was tested on Monday and tested negative. So. But it just is a reminder to me and everybody that we still have to do the hard work. And I want to thank the health department for their outstanding work, contact tracing, in a situation and in all the other situations. They're still doing that work. The vaccination update news is that we are now putting out a weekly report as soon as we get our allocations from the state. The state did say in their guidance to providers that those allocation numbers would be available each week on Friday. We got them at 11:48 on Saturday this week, so our report went out a little bit late, but we are thankful that we are getting once again 3,400 doses. We were concerned that it might drop again as it had to the health department. Concern Anne Arundel Medical Center, which had gone from 1,000 to 5,000 back down to 1,000, is now at 700 this week. Also concerned that of the doses that the State Department of Health made public in that notice, we know 88,000 are coming from the feds, but only 49,450 were listed in that notice. So the other 38,000 plus, we're not sure where they're going. They're not publishing the data on how many doses are going to their pharmacy chain partners or to their state mass vaccination clinics. So that's still an unknown. We did have a lack of second doses. Dr. Kalyanaraman may talk about how this all worked, but my understanding is that we were told second doses would be coming from the state based on their orders from the feds of the Pfizer vaccine last week and the week before. And it came down to the day that folks were scheduled, and we had to reschedule 1,374 of our residents scheduled for second doses. And I apologize to every one of those people that this was necessary, but if the doses aren't there, we can't put them in your arms. So believe me, we are working as hard as we possibly can to get those doses from the state, and we're told that they will come now on Wednesday. We hope they will. Also had to do some rescheduling as a result of snow once again this weekend, 2 weekends in a row. And I just want to thank all of our health department staff, our Department of Aging, my community engagement constituent service staff that's been deployed to make thousands and thousands and thousands of calls. There are 2,500 calls a week coming in just on the COVID hotline, and the work that our team is doing, particularly our health department, to make all of these changes happen is really it's amazing to see. And we're getting a lot of emails from folks thanking us for stepping up as public servants and doing this extra work. We have 116,000 in our COVID, aacounty.org/COVID vax pre-registration system. And of those, 16,000 are still folks over 75. Now, it's possible that some of those have gotten vaccinated and did not remove themselves from our list. That's one of the frustrations of having so many different pre-registration sites for the different providers of vaccines, is it's impossible to know exactly who's gotten vaccinated at that stage of the game. The way that we're doing our selections from that list for our county vaccinations is that we have software that randomly selects within the priority groups that have been identified and produces a result that reflects the demographics of the county. We also have our team at the health department has been working on an extensive equity plan that will be going to our task force for review at their next meeting that we'll be talking about probably next week to make sure that the doses are going into the arms of all of our residents, including those who are most vulnerable and underserved in their communities. Of the 3,400 doses that we are getting to the health department this week, we made a difficult decision to divide it up based on priorities. 1,500 will go to seniors 75 and over, the most vulnerable from a health standpoint. Another 1,500 will go to educators. And of those 1,500, 1,000 will go to our Anne Arundel County Public Schools staff and 500 to private school and childcare educators. The ratio is 2-to-1. That's about the ratio of the population in those different groups. Of course, our Anne Arundel County Public Schools is being vaccinated by the fire department, and that's being organized through the school system. So they have the names of those teachers and educators and are handling that. So if you're a teacher in the public school system, you can go elsewhere to try to get vaccinated. Everybody is going everywhere at this point, trying to get vaccinated as soon as possible. But make sure that the school system has your name that you want to get vaccinated. They did a survey and should have that. And I just want to apologize to everybody who is out there doing vaccine surfing. It's not easy. It's very time consuming when so many different providers have so many different sites. The most recent, I guess, to come up for our residents really is Six Flags. They're only 6 miles from the border of Anne Arundel County. And they opened up on Friday. We were not able to get our list to them. They first asked for a list of seniors over 65 actually, to vaccinate. And then a couple hours later, they said, no, they don't want that list after all. Then we're told that they got those names from Prince George's County. Still unclear. There is a state site to sign up for those vaccinations. Sometimes it accepts folks and sometimes it doesn't. When I tried it, they told me that there were no vaccine sites in my area to pre-register for. We are talking to our pharmacies. Giant is the one in Anne Arundel County that has sites. We are talking to the hospitals regularly, and we are talking to the state in the hope of getting partnerships established so that folks from our list can get sent over and get appointments at some of these other providers, and that is ongoing. And I also want to say that for our teachers, we need to get you vaccinated more quickly, and I am very acutely aware of that. And we have these conversations on a regular basis. And I really want to try to get as many vaccinated as possible, at least first doses before people go back to the classroom. We know that not only teachers are concerned about needing vaccines as they go back, but parents as well. So, we only have 60 to 70% of parents said they were not prepared to send their kids back to classrooms. And that just shows me that there is still concern, and we want to make our schools safe. I can assure you that we are hustling to get all the vaccines we can and get them to teachers, while continuing to realize that our seniors 75 and over also have great needs. There was a letter that the Maryland Association of Counties organized. It's very similar to the letter that I had sent to the governor, and the topics that we talked about and the suggestions that we talked about for the state. 31 county officials from 21 counties plus Baltimore City signed on to this letter, and it has 5 requests to the state. They are, and we can make this available, or you can find it on the Maryland Association of Counties website as well, but to share the weekly allocation publicly and release it sooner so that people know, and include all of the providers, not just hospitals and health departments, in that information. So people know if they're surfing who's got vaccines, where to put their time in. Demonstrate that counties are getting their fair share by population, and by publishing all of the allocations by distribution site. So not just saying how many a pharmacy chain has statewide, but how many locations they have in each county. Fulfill local health department weekly requests before allocating doses to private providers or state sites. And we all know the benefits of local health departments doing this. They have the equity lens. They have used taxpayers' money to stand up their capacity to be able to deliver these vaccinations. And we believe it's only right to ask them to stand up rather than stand down at this time, and provide doses to them first. We request each week how many doses we want. I believe we've been requesting 7,500, but getting 3,400. And then allow local health departments to operate one-stop pre-registration or create a statewide system so that people don't have to surf so many websites. And finally, expedite the release of the $400 million in federal vaccination testing and contact tracing funds, and provide direct grants to local health departments. We were notified last week that 114 million of that 400 million would be available to local counties, but not as grants, simply as reimbursement for expenses. And we have no information yet about how that reimbursement will work. But we are going to aggressively in Anne Arundel County use as much of that money as we can to provide services to our residents through the health department. I also just want to mention to people that there have been scams, people calling folks, particularly seniors, and offering them vaccines, asking to meet in locations for vaccines. Please, we don't call people to offer vaccines. We do call people about scheduling and and changing appointments and things, but and there is a state contractor that has been hired by the state of Maryland to call people as well. I think that's part of the GoVax program. But beware, don't go meet people for vaccines in places that have not been published as vaccine centers by the state or by the county. Two quick stories that are out there that I don't think have, this is moving on from COVID, that have been covered much, but that I believe are really important. One is that for the Bay Bridge, a study came out. It was contracted by the Queen Anne Conservation Association, AKRF Planning and Engineering, which is a Hanover-based company, concluded that the Bay Bridge third span was not necessary, that the no-build option was likely the best option, that the bridge would be good, the 2 spans until 2065 with maintenance, that the traffic projections in the state study were overblown, were based on projections of growth and development on the Eastern Shore that are unlikely to take place, and that they had not considered the impacts of all electric tolling, variable tolling, telecommuting, and other factors. So this was, for me, good news for those of us who believe that a 3rd span at Route 50 would not solve problems, but would create problems and would encourage growth and development on the Eastern Shore. It was good news. In contrast to that, a transit-oriented development study came out from the Greater Washington Partnership that included Prince George's and Anne Arundel counties, and made the case for transit-oriented development at Odenton, Cromwell Station, the northern end of Glen Burnie, and Laurel. And that is exactly the kind of growth and development and transportation strategy that Anne Arundel County has proposed in Plan 2040, that is before the County Council, and that is in our transportation plan, Move Anne Arundel. We want to get cars off the roads, and we want to protect the environment with our transportation planning. And finally, our warming centers are open February 9th through the 15th. The temperature standard that we use now is that we open them when it's projected to be 32 degrees or lower. In the past, it was 25 degrees. Before that, it was 20. I understand that way back in the day, they didn't open until it got below 15 degrees. So I think we're becoming a little bit more compassionate, and those centers are at our police district stations. And then finally, I want to thank Economic Development Corporation for getting out the last of the restaurant assistance funds that came from Commerce. My understanding is that after many weeks of waiting for those funds to be transferred over to economic development, that they came last week and they got into the bank accounts of our local businesses in an incredible 3 days turnaround. So 634 businesses, when you combine the 3 installments of restaurant funds that have gone out, 634 have benefited, and it's a total of $13 million. So it's not enough to solve the problems, but I want to thank Economic Development for being so incredibly efficient about getting those funds out. So enough for me. Over to Dr. Kalyana Raman.
Thank you, County Executive. Let me start with where we are this week. So we continue to see a decrease in our case rate, down to 21. This is 4 consecutive weeks of decrease, which is fantastic. That's exactly what we want to see. We've seen that our hospitalizations have been fairly steady in the past week or so. They're down to about the mid-90s collectively between those 2 hospitals. Our acute care and ICU occupancy is in the low 80%, 82 for acute care, 83 for ICU, so very comparable. In terms of the percent of the population tested, we did see a pretty significant decrease in the percentage of folks tested. So 3% compared to 4.1% last week. So that is a bit concerning in terms of, are we missing cases? Our percent positivity is pretty much flattened out. It was 6.2% last week and 6.3%. So sorry, 6.2% the week prior, 6.3% last week. And we're seeing that our deaths, we had 17, we had 17 last week, and sorry, 14 last week, apologies. 14 last week and 27 the week prior. And so certainly an encouraging sign that we are turning the corner on the number of deaths. But as County Executive noted, we are reaching a pretty somber milestone in terms of being close to 500 deaths from this pandemic. And just a reminder for those who die, but also for those who have severe disease and are affected with long-term symptoms, this does carry a significant weight for many people, whether they've lost a loved one or are feeling the consequences of this. And so we will continue with our efforts. Now that our case rate is down into the 20s, our contact tracing is back to getting in touch with all contacts again, which is what we said we would do, that once it came back into the 20s, we would do that. And so here we are. We do want to keep the case rate down where it is right now. And we also want to encourage people to get tested. Now that the case rate is down, folks are feeling a little bit less at risk. A little bit less testing is going on. Testing is available. And we want people to, particularly if they have been in any situations where they could have been exposed or have been out with others that they're not usually with, to get tested. That's really an important cornerstone of our work in preventing this case rate from going back up again. Transitioning to vaccines. In the county, 62,000 vaccines done, 46,000 first doses. People got first doses, 16,000 have gotten both doses, so that's 8% getting first doses and 2.8% getting both doses. In the health department, we've done 22,000 first doses and 6,000 people gotten both doses, total of 25,000. We've received total of 25,000 first dose vaccines. Our allocation for this week is 3,400 doses again, and the county executive mentioned are split amongst educators, 70, those over 75, and healthcare workers. That's why we're in phase 1B. We still have about 39,000 people who are pre-registered in 1B, and we do take names off the list after they get their first dose. And we're sure that a small percentage of people have gotten vaccinated elsewhere, but still 39,000 is a lot of people who have expressed an interest in getting it. And if we're getting 3,400 doses and the hospitals between them are getting less than 1,000 doses, it's going to take well into March to get through this group. So we really ask folks for their patience. I know it's difficult. What we're recommending is for everybody to get pre-registered. When you do that, remember that it's still important to wear your mask, distance, and avoid gatherings. We will get through this. It will take a little time, but we will get through this. A category that was added into 1B is people with intellectual and developmental disabilities, and we're working through how to ensure that individuals who meet that criteria can get vaccinated. Overall, we have 122,000 pre-registrations in our system, and that reflects over 20% of the population of the county. But we're seeing some inequities in how that's playing out. We see that of the pre-registrants, only 7.3% are Black, only 3.4% are Hispanic, so less than 50% of what we would expect based on demographics. Whites compose 78% of the pre-registrants, and Asians, the only demographic that's on par with its population level of 3.8%. And so, as the county executive noted, equity is critical. And so we're ensuring that when you signed up doesn't affect whether you get an appointment or not, as long as this is your phase. And so the appointment invites are being done randomly to people eligible to make sure that there's access to vaccines for everybody. One of the things we heard is, well, if there's a huge list, why should I bother signing up? Well, it's important to get your name there. It's important to demonstrate interest in the county, and we continue to push to get more vaccines into our county. And we're also adjusting our demographics of the invites to make sure that minorities are not underrepresented. That's a key part of this. We want to make sure that everybody has equitable access to vaccines during this time. One thing that we want to also highlight is that our mobile clinics will start going out, vaccinating at 2 independent living facilities this week. And we're working with aging and the housing authority in both the county and the city to ensure that across independent living, senior housing, and public housing, that every single one of those facilities has a plan for vaccination, whether that's through a commercial pharmacy or through the health department or through one of the hospitals or some other mechanism. And those will be ongoing over the next number of weeks. As the county executive noted, we also obviously had to reschedule over 1,300 appointments between today, three clinics today and one tomorrow. These are all second dose appointments, and they're all for people who had Pfizer as their second dose. This is because we are short. We haven't received second dose vaccines that were due to arrive last week, and we have a shortage of 2,000 second dose vaccines that were due to arrive 2 weeks ago. And so we always schedule second doses at the time of the first dose so that people don't forget, so that we don't lose anybody. And implicit in our system was that we were going to receive the second doses on schedule. And so we are waiting for receipt of those overdue vaccines. We're supposed to get them tomorrow. And we are rescheduling those 1,300 plus people on Saturday to get them vaccinated. And I echo the county executive in apologizing to those who are affected. I know it's frustrating. And that's why we want to make sure we get you on Saturday. So with that, I will turn it back over to you, Roz.
Thank you, Dr. Nilesh. Following up on your comments about vaccines, Kate O'Mara has a number of questions that she would like greater clarification on. Kate?
Hi, thank you so much. I may have missed it, but I just wanted for you to clarify the number of doses that and the type of vaccine that were delayed last week and this week, and what the explanation was from the state. I thought maybe you said it was weather, but I wasn't really sure. And if it's only why only the second doses were impacted, not the first? I'm wondering maybe it was because just Pfizer was delayed and not Moderna. So if you could just offer some clarification about what's behind this and give us some hard numbers. Thank you.
Yeah, so it's about 2,000 doses, 2,000 second dose Pfizers from a couple of weeks ago, so the week of the 25th, January 25th, and approximately 5,000 second dose Pfizers from last week that are delayed. I don't have an answer yet as to what caused the delay. So MDH does the ordering. We don't. So I don't have the ability to tell you that. Just that we have been working with them over the past couple of weeks to try to rectify this. And unfortunately, because we're due over 7,000 vaccines from the past 2 weeks, we ran out of second dose Pfizers, and we actually don't have any Pfizer doses on hand. So it isn't a matter of using first doses, vaccines allocated for first dose for second dose. We can't do that. We don't have any Pfizer on hand. And so we had to reschedule them. We're continuing with our first dose vaccinations. Those are with the Moderna. And so of course we can't swap them out for the second dose Pfizers.
And if you may, that answered my question. Thank you. And if I may, at what point, how long do you have until the window for the second dose closes? Because you mentioned the end of January, you were expecting some, and there might be 7,000 people at home freaking out that they're not going to get their second dose of Pfizer. So how long do you have left? A week, 2 weeks?
Yeah, the recommendation is that you can go as far out as 6 weeks, although there isn't really any reason not to, even if it goes beyond that, there isn't a reason not to get that second dose. But the CDC recommendation is that you can wait up to 6 weeks to get that second dose. So we're still well within the window. Nobody's in any danger of this being any less effective. Really, the hard stop is that you don't want to do it too soon, actually, to make sure that your body has enough time for that second dose to take effect. So we're still, everybody who's getting rescheduled is still in a good spot.
All right, let's go next to the Capitol. We have questions from Olivia Sanchez and Daniel O. Olivia?
Good morning, Mr. County Executive. First, sorry to hear about your exposure to the virus. Hope you're feeling okay. I was wondering if you could tell us when and where you were exposed. I think you're on mute, Mr. County Executive.
Sure. I mean, I can tell you that at one of our budget town halls, there was a proposal that we do a kayak launch site at a park. And so I wanted to go out and see it. So I scheduled the time to go out and see it. And a handful of folks were there with me. And while we were all masked and outdoors, we were standing around talking to one another for a long enough time that the health department thought that there was enough risk of exposure to quarantine.
Well, hopefully that the tests come back negative.
I did get tested yesterday and it was negative. So,
Oh,
but they
good.
tell you that you still quarantine because the test was, I think 5 days after exposure and you go for 7 days. Dr. K can explain all that to you, but I'm just following the rules.
Okay. Well, one more question. With the case rates, declining and the metrics looking good overall, are you considering like relaxing any more restrictions at this time?
We are looking at a few things. I mean, there's not much more we can relax. I mean, we're pretty close to in alignment with the state, but not completely. So yeah, we're continuing to have those conversations this week, and there could be some additional minor things.
Any hints on what those might be?
Well, I mean, they're the areas where we in the state are not consistent. So I think there's some businesses that are at 25 that might be able to go to 50.
Thank you.
Danielle?
Hi, thank you so much. Mr. County Executive, has the county considered at all trying to buy vaccines directly, similar to the attempts by Baltimore City?
I will let Dr. Kalyana answer that one. I guess the answer is we have not made, our purchasing folks have not been out there scouring the market doing that, but he could explain why.
I don't think it's gonna work. So the federal government has exclusive contracts with the vaccine manufacturers as part of how essentially they were funded to develop and manufacture these vaccines. So at the end of the day, I don't think it's gonna do anything to try to buy a vaccine. If this is confusing, having jurisdictions compete with each other for vaccines will be a nightmare. And we saw that, remember, with the testing and PPE purchasing back in the spring and how challenging and difficult that was. I don't think it's going to happen.
Understood. And I can't recall who said it, but in regard to the Six Flags site, I think it was Mr. County Executive who mentioned that the state had initially asked for registrations and then did not need them. Can you illuminate that a little bit more, what you were talking about?
That was actually taking place, I believe it was Wednesday afternoon, and it was through the Department of Aging. It was raised at a staff meeting that the state had made this request. We were pulling together a list, and then in the middle of the meeting, another email came in saying they didn't need them after all.
So
I mean, we didn't contact anybody offering them an appointment. I just mentioned that because it was an example of the confusion that we've had with how our residents can get access to the Six Flags site. It's within 6 miles of our county. We were told that 40% were going to be coming from the Prince George's folks, guaranteed. Of course, we would like to have some, reserved for our folks, and we've not been able to get there yet. I guess Secretary Schrader, Acting Secretary Schrader, said yesterday that they had signed up. I think he said 22,000, very large number, made appointments for that site in a very short amount of time. But we're reading about this in the newspaper. So we're still struggling to try to get access for our residents to the Six Flags site and to get a better answer on how our residents can register there.
Okay, and one last thing really quickly. I think last time we spoke, I asked about South County vaccinations. Has there been progress on the mobile sites for South County?
Well, there hasn't been much progress in getting doses, but Dr. K can tell you about the planning.
That's true.
Yeah, no, there is progress on that. We are looking to finalize some agreements to have a site in South County. So fingers crossed that that's coming next week if we can work out all the details. And as the county executive noted, this is all pending us actually getting enough vaccines to be able to do this.
Great, thank you very much.
Great, thanks. Going next to John Frenaye, Eye on Annapolis.
I've got a question for actually both of, one for each of you. I guess for Dr. Colin Arman, there's the UK variants. Most people are concerned that it may become dominant. And I know at one point several weeks ago, you had said that our testing capabilities didn't have the ability to determine whether it was a UK variant, or now we're looking at a Brazilian variant and a South African variant. Has that changed at all?
Yeah, so the testing doesn't pick up variants. That's done by the sequencing. So there's this a sample of tests that are run are being sequenced to identify those variants. And then also if there's particular clinical criteria or travel criteria, those folks get their virus sequenced as well. And that's done in coordination with the Maryland Department of Health. The changes are too small generally to be detected by the PCR tests that are being run or the antigen tests that are being run.
How then does one get sequenced for their test? What is the determination from me going up and getting a test and just saying, hey, I'm negative versus, or what variant I might have?
Yeah, like I said, that's actually made more. So some labs are starting to do more sequencing to be able to detect what percentage. The CDC is encouraging states to do more sequencing, and our state is doing more sequencing. I know that the Hopkins lab is doing more sequencing as well. So it isn't really an option for an individual to say, I want my virus sequenced if you're positive. It has more to do with lab and clinical capacities. Sorry, clinical criteria, lab capacities and clinical criteria.
Okay. And for Mr. County Executive, with the increase to a 50% capacity on restaurants, has the requirement for restaurants to do their own contact tracing been eliminated? I didn't see that addressed in the revised executive order.
No, that's still in place.
And then I guess a follow-up to that one, what has been the take up on that? I've heard anecdotally that your number has been entered in all over the county for their dining.
Say that again. What's been the take up on it?
Yeah, I mean, have the restaurants been complying with that for the most part? I mean, anecdotally, I've heard that people are saying, oh yeah, my name is County Executive Stuart Pittman and here's my phone number when they voluntarily fill out the card or the QR code. I'm just wondering what the take up has been on the restaurants, whether they've been reporting that and whether it's been effective.
They don't submit that information. They hold it so that we can use it if it's needed, if there's an outbreak.
Has there been an outbreak at all to the point where you've needed to go back to look at that data?
I'll let Dr. Kalyanaram answer that one.
No, we haven't. We haven't used that yet, and that's one of the details of this is somebody would have to tell us that they were dining there for us to be able to pull that list. Of course, if somebody's working there, that's different. We have that information, but that's what it would take for us to request it, and we would request it at that point. But we don't want that information unless there's somebody who's positive.
Okay, thank you very much.
Great.
And I would just add that while there are people who scoff at these kinds of measures, that they are still, in my view, worth having in place, even though there are going to be people who put in wrong names and don't believe in it. That if we can prevent some infections and save some lives, it's worth doing.
There's several more questions in the chat. Let me just ask everyone to be mindful of the time. Let's go next to Don Harrison, MAR.
Yes, I have a couple of questions. First off, with the delay, how's the Thursday with the teachers at Severo Park High School? I guess they were supposed to start there. How's that looking for them?
I mean, with the delay and the rescheduled second doses?
Yes.
So this doesn't affect that. Those are first doses that are being administered. Those are first doses that we received last week. And so this doesn't affect them.
All right. What's your concern that this backup is going to continue to back up, and it instead of a slowly coming in, it might dry up at some point?
Yeah, in terms of the second doses, our understanding is that there are second doses allocated for every first dose. This seems to be related to ordering shipment issues. Like I said, I'm not quite sure where in that chain, but we're hoping to get those tomorrow is what we're being told. The drying up part is probably more relevant to first doses and what that means for us as a county, but that's the state allocation and the transparency that the county executive was talking about.
All right, doctor, maybe you or the county exec would know, help people understand maybe line jumping or changing or sharing appointments. How disruptive is that? And can people say like, well, I can't make it, so I'm going to send my kid or something like that? I mean, to help people understand what that does to the system, or is there a problem with that for the system?
Yeah, it is an issue that we see. So line jumping. So we do ask people what criteria what's their criteria for their phase, because we do want to honor the integrity of this process. We know that hundreds of thousands of people are waiting in our county. And so as we've asked people to abide by the honor system, but we're also doing a little bit of verification. We see and we don't have the data to be able to tease apart the two, but we see that particularly at our Maryland Live casino site, we've had to turn more people away who got the link from somebody else and signed up and really shouldn't have been there. And it's disruptive for our staff, and it also takes up a spot from somebody else. And so we could have given that vaccine to somebody if they didn't sign up when they shouldn't have.
Very good. One last thing, and we alluded to this earlier, and I've heard about this, and I guess witnessed it myself. It seems like a lot of people are not taking the contact tracing in the restaurants seriously. They put a lot of false names and false numbers, and with all the other things that are going on and different procedures and protocols, does this still seem like a worthwhile exercise? Because it doesn't seem to be an effective survey per se, and it's been out for a few weeks. It hasn't been used at all yet, evidently. So does it seem like it's a worthwhile exercise for restaurants to keep doing this?
Yeah, it is. The point isn't, if we were having to use it every day, that would be a significant problem in and of itself. The point is that if there is an exposure that we can track back, we have the ability to do contact tracing. And I think one of the things that's probably underappreciated is that a lot of our efforts are going to have a small effect, but they all add up over time. And so this is another one of those that, while it will have a small effect, it will have a real effect when we actually have to use it. And so I echo the sentiment of really asking people to understand why we're doing this, and it's really a small inconvenience. It takes about 10 seconds to write your name and your phone number, but has the potential to really break that chain of transmission if it does happen that you were exposed.
Very good. Thanks very much.
I would
Yes.
note that, just add that when we proposed this to the restaurant leaders, that there was a lot of positive feedback for that they felt it would give people a little bit more of a sense of security, that there would be contact tracing, they would be notified if there was an outbreak, and the paperwork burden is low on this. So we haven't heard pressure coming from the restaurant industry that they want to end this by any means.
Very good. Thank you, gentlemen.
Mr. County Executive, Dr. Nilesh, how are you guys doing for time? We have several more questions. Should we just keep going?
Okay.
I am supposed to be in another call. Are any of these questions burning questions for me?
One of them has to do with the teachers returning. Rachel Pacella, the Capitol.
And you can, I think it will be a pretty quick answer. But I'm just wondering, you had said earlier that, you would like to see as many teachers as possible vaccinated. Are you guys having trouble hearing me?
Yeah, we're having trouble with your audio.
Then I'll follow up later.
Great. Let's go to Rick
And
Hutzel.
I'm gonna jump off too. Hopefully people can contact me directly if they need something. Wanting to get in touch with me. Thanks.
So this is a question for Dr. K. I mean, someone else in the conversation talked about line jumping and things like that. Is there a bioethical guideline for people as they try and get vaccines? Should they, I mean, we've had letters to the editor from people who said, hey, I drove the 115 miles to Berlin at Atlantic General and there was no line. So, there are people who are showing up hoping to get leftover vaccines. There are people who are, as you mentioned, maybe exchanging appointments. Is there any kind of best practices now that people are being told to site surf for what to do and not to do?
Yeah, I mean, that is a feature of how it's happening in Maryland, that people are being told from the state level to sign up on multiple sites. All we ask is that you be honest, and then when it's your turn, absolutely go get that shot. There's no issue with that. The ethical framework was developed and put forward by the Advisory Committee on Immunization Practices. That's the federal committee that's part of CDC that says who should get vaccine and why. And particularly is in place because there's limited supply, right? If there wasn't limited supply, we wouldn't have any of these phases or these prioritization schemes. And I guess the other part of it is that we understand that there's people who are waiting for vaccine at the end of the day. The reality is there really aren't doses at the end of the day that are left around. There's usually maybe 1 dose or 2 doses at most, and we typically get somebody who's in line who meets that criteria. So really want people to, I know there's this desperation to get it, but not invest their time in that because it's really not, at least in our county, it's really not playing out that way, that there's doses to give away at the end of the day.
What about crossing county lines? I think early on, maybe 2 weeks ago, the county executive said, he would not recommend it. Now they're being sent to or they're trying to get to Prince George's County. What about going to other counties' distribution centers?
Yeah, and this gets into what that distribution center is for. So the mass vaccination sites are set up to serve all state residents. As a county health department, our task is to protect those in the county who work and live, and so those are going to be our priorities. If we have extra, we'd be happy to do others in the state. We're nowhere close to that. You see the hospitals, same thing. They're working on their patient base and their catchment area. And so it's just a little different. Each of the organizations that is getting vaccine has a slightly different focus. For your commercial pharmacies are gonna pretty much vaccinate whoever, right? As long as they're in phase. And so we're fine with people doing that. That's the system we have. So if you can get your vaccine elsewhere, like at the mass vaccination site or the pharmacy, please go ahead and do that.
And then one final question on this issue. Some public officials and others have declined to take the vaccine because they believe other people are more at risk or more deserving right now. Is that a wise thing, or does that cause us a problem down the road?
So I believe you're referring to the continuity of government group that's in phase 1B. And so there's
and others. There have been others who have said, look, I'm not going to get it right now because my 85-year-old grandmother needs it, and every dose is one less for those people.
Okay, I hear you. So our recommendation is that when it's your turn to get it, if you want to wait, you certainly can. It's not like you miss your turn. Just you'll still be eligible later. And the reason for that is that there's both a individual risk component that's built into the guidelines, and then also a critical for societal functioning component to that. And so, when we hear about individuals who say my personal risk is not there, that's a decision that you're free to make. We just ask that you, once you're comfortable, get it as soon as you feel comfortable. Because when it is eligible for you, you should get that shot.
Thank you very much.
And finally, the last question goes to Joseph Ojo, Fox 45.
Yes, wanted to get your kind of a take on this, Dr. K, because there's been a little bit pushback on this. So the CDC is saying that schools can safely reopen without teachers getting vaccinated. What is your take on this? And is there any date and timeline on when these vaccinations will kind of start for teachers in the county? Will there be any type of thing set up with AACPS, like a vaccination site solely for educators?
So educators in the county are getting vaccinated starting this week, and will be, because we have limited supply, we're doing 1,500 going towards educators this week to be able to continue that next week and in following weeks. And it's a mix of ACPS and private school and childcare. And so we are hoping to get more vaccines so we can vaccinate more educators. The CDC is saying that vaccines are not a requirement to go back to school, because there are a lot of different mitigating factors that are in place, or should be in place, and will be in the public schools here, to decrease the chances of transmission. Vaccines are one of those tools, and they are an important tool, but they're not the only tool to mitigate the spread of COVID.
And have the vaccines started already, or are they going to start later this week?
They'll start later this week.
Any date or time?
So I believe so I actually don't know the date or time for the private school and childcare. They're mixed in throughout all the clinics. The AACPS and FIRE have a partnership, and that's going to be happening on Thursday.
Thank you.
That's still true, right, Roz? It's still Thursday? It hasn't changed yet?
I don't believe so, but Bob, would you follow up, please?
And I only say that because of weather issues.
So far, it's still Thursday.
Okay.
Yep. All right, great. All right, everybody, thanks